Today's show is all about new ways to improve your body, and we've got an easy solution for another big frustration that women have, spider veins. Dermatologist Dr. Jessica Wu is here with her patient Christina to show us how this works.
Welcome, ladies. How are you?
Yeah, great, thanks.
So, Christina, you have some spider veins, right?
Yes.
On your legs,
Yes.
right?
Mm-hmm. I like to cover them up whenever possible. I never wear shorts, rarely wear skirts or dresses.
And such a common problem, especially in women. And why do we call them spider veins? Well, as you'll see on Christina, that their appearance is like little spiders under the skin. But you have a new solution for us today, right?
Yes, I do. Now, up until recently, the standard of care was injections with saline or saltwater solution. Now, the problem with those is that it can be very painful, can cause leg cramping, and even occasionally skin ulcers or skin sores.
And I've seen that.
Yes. Now, what's brand new and what's just recently been approved by the FDA is a new solution called ASPIRIN. And this is a solution that is similar to the saline injected into the veins. And what's new about it is that it's much less painful and there's much lower risk of skin ulcerations. So it'll be much more comfortable for Christina.
And we're going to do it right now.
Yes, we are.
On you. Are you ready?
I am. So what I'm going to do is put on my attractive visor here, my magnifying goggles. And the reason I need to do that is that you remember that when we inject the solution into the veins, I've got to put the tip of the needle into each little vein to make it collapse. So the first thing we'll do is clean off the area. And Christina, I'm going to have you turn your leg out a bit, just like that. And then I'm going to wipe off with a little bit of alcohol, just like this. And I'm going to slip a teeny tiny needle, which is very, very thin, just underneath the skin, and you'll be seeing the treatment right before your very eyes.
Okay.
I told you it'd be neat.
And
Okay.
these are non-functioning veins, so there's no functional problem at all in
It's to be
sclerosing these.
differentiated from varicose veins, which are much larger and knottier, and they potentially can lead to edema in the lower extremities.
Yeah, you certainly don't need these veins. So, you ready, Christina?
I am.
Okay, here we go. You're going to feel a little pinch on the count of 3. 1, 2, 3.
So that fine needle tip goes right into that vein.
In the vein now. And you're going to see a
You all
little
right?
flush.
Yeah. I can feel it a little bit, but not bad.
Good. Do you see it flushing away?
I do.
Yeah.
Here we go. Veins flushing away. And what this tells us is that the solution is getting into the vein exactly where we want it to be. And over the next few weeks, your body absorbs it, and eventually it will disappear.
So in a case like this, you have to do multiple little treatments in all those, because she has multiple spiders in that area.
Yes, yes.
But that
absolutely.
area is clear now. You
Yeah.
can see that where she had that discoloration.
You can see it's clear, and that tells us that the solution went exactly where we wanted it to be, and the rest is up to your body to absorb the vein and dissolve it. So I'm going to send you home with a little bit of cotton and a dressing.
Okay.
And I'm going to tell you to take it easy for a couple of days. And within about 4 to 6 weeks, you should be much smoother, much clearer. You'll be able to show your legs.
Okay.
And we have some pictures of how this works. Somebody who's before treatment and after treatment, that's a big difference. Dr. Wu, you also have something new with you here today, correct?
Yes, I do. I have another device that's called the vein viewer. And what's wonderful about the vein viewer is that we're able to see veins that are underneath the surface of the skin that's not available to the naked eye.
Which would be particularly great, for example, in kids or dark-skinned people, people that have deeper veins, veins that are harder to find when you want to start an IV, give chemotherapy, that kind of thing.
Absolutely, and in fact, even for Christina, for example, she's got some veins that are a little bit above where we treated that we can't see that easily with the naked eye, and we'll be able to see much more clearly with the vein viewer.
Let's show everyone how it works.
Yeah, let's see it. Come on out.
Sarah's going to help us out.
Okay. So what we're looking at now, the green is Christina's vein that's sitting underneath the skin. Now, if we take the vein viewer off, you'll see that you can't see the vein very well. And if I wanted to try to inject this, it would be a little difficult for me to try to find the vein. So what I do is I use the vein viewer, and now you can see the vein much more clearly underneath the skin, so I'm able to inject it much more effectively. And you can see the
Neat
vein
tool, look at that.
and the blood flowing back. The green is the blood going away and flowing back. So you know that that's a vein.
Very cool.
All right, while we have you here today, Dr. Wu, today we're doing what patients should do prior to procedure, surgery. What kind of instructions did you give Christina prior to having her veins injected?
Well, I told Christina for 48 hours before the treatment, try to avoid alcohol and also stay away from aspirin for a few days before to minimize the risk of bleeding and bruising.
Important in all procedures in here, if she's on aspirin, those veins may be very sensitive and bleed.
Yes.
Thank you.
Special thanks to Dr. Wu and Christina for being here. And you can find additional treatments and prevention tips for spider veins on our website, thedoctorstv.com.